Hey, everybody. Welcome to our regular Friday get-together with what's new and coming up with lipedema. I'm Leslyn Keith with the Lipedema Project and Lipedema Simplified, and I'm here with my friends and colleagues, Gail and Siobhan. Gail, can you introduce yourself?
I sure can, Leslyn. Thank you, and it's good to see you. I'm Gail Straker. I'm the community manager for Lipedema Simplified, and I've been hanging around here with Leslyn and Siobhan for a few years now, and I'm enjoying everything about it.
And Siobhan, go ahead and introduce yourself. You don't have your usual little tagline of what you're.
Yeah, I forgot to add it this time. I'm the research specialist with the Lipedema Project. I read a bunch of stuff. Sometimes I rant about TV shows before we go on air. And I talk about lipedema related stuff.
And so if anybody wants to know what that rant was about, go ahead and post. We'd love to have you guys, participate in our discussion. And speaking of that, Marianne has already posted a question. So we're going to go ahead and start with a discussion about that, because it was so nice of Marianne to post something and to make sure that we're talking about the things that you guys want to talk about. And so Marianne says, how is it going for the fight for insurance companies to pay for special procedures for surgical intervention for lipedema? And that's a great question, Marianne. And I will tell you, I don't focus a lot on surgical interventions, but I know a little bit about it. So let's have a discussion, because maybe Gail or Siobhan, you guys know more than I do when it comes to that. But it kind of depends on what your insurance is. There are insurances that pay, and there are women in the US and in other countries that are getting liposuction procedures for lipedema. There is a special procedures that are called lymph preserving or lymph. It's the kind that
Sparing.
Lymph sparing. That's what it is. Thank you so much, Siobhan. That hopefully we don't ruin the lymphatics, don't stress them too badly with the procedure. But Siobhan, since you knew that term, lymph sparing, do you got anything on surgeries, and what do you know about coverage?
Yeah, so I don't know a whole ton about coverage, but in terms of, I think it's a good thing to ask in the Facebook groups, because there are a lot of people who've had that experience. And it's one of the benefits of community is that they can say, I had this type of insurance, I live here, I had this done with this person, and here's how it went. And another aspect of that is sometimes they had to have back and forth in terms of the coverage, in terms of putting letters together and submitting all this stuff.
Right.
So I know there are people who are actively working on it. And I think, like you said, it depends a lot on who you have insurance under, what kind of diagnoses you have, all that type of stuff, who you go to. So it's a good community, like drawing on the community to get as much information as possible and see what's kind of available.
And what you also mentioned too, Siobhan, is key too, because it's not just about, is it covered, but how did it go? What was the outcomes? What should I know about it? And so, being able to discuss the procedure itself and how it went, I think is really key. Gail, what's your experience with this whole thing?
So everything that I've heard, almost everybody I know has had to travel, because there are so few specialists. They either had to travel to Europe or they've had to travel to California. People out here,
Florida.
they've had to travel, and of course insurance isn't going to cover your travel expenses and your lodging while you go through all that. And every single person that I know personally, like that I have spoken to personally, they didn't get insurance coverage.
Oh, interesting.
They've had to pay for all of it themselves. And now I'm not always sure if it's because the insurance company doesn't cover it, or because doctors aren't accepting the insurance because it's so low. So a lot of procedures, doctors don't accept insurance simply because the payout is is so low. So, and like Kathleen says, where are these specialists?
Well, and I would tell you to go to our provider directory at lipedemaproject.org, and it has a big map of the world, and it has underneath it, it has different categories: therapists, doctors, surgeons. And so you want to just click just surgeons, and then you can see where they are, because there are a lot of plastic surgeons that say, oh yeah, I can do this for lipedema, and they've never done anybody with that diagnosis before, or very few. You want to go to someone who specifically does procedures on lipedema, and they do the microsurgery on the lymphatics. So you want someone who has that skill set, because if they only do liposuction, they know nothing about the lymphovenous bypasses or any of the other stuff, the microsurgery that might be necessary for you along with the liposuction. That's not someone you want to go to. So look on our website, the provider directory, click on surgeons underneath the map, and seeing where they come up. Like Gail says, in order to find someone with that kind of expertise, it's likely you'll have to travel.
Yeah, and I will say that this was a big topic at the World Lipedema Congress, because part of the potential reason it might not be covered by insurance is because it's considered a cosmetic procedure. So part of the issue with navigating it is establishing that it's actually not just cosmetic, although
medically necessary.
Yeah, medically necessary, addressing disfigurement of the disorder, things like that. And establishing that it does help reduce pain, or it can help reduce pain in some people and help with mobility and things like that. So I wouldn't be surprised if this is going to come up more and more in the following years. And it's definitely something that the lipedema community is thinking about on how to kind of get this moving forward for people.
And I would say, the various papers that have been published from surgeons that specialize in doing liposuction for the lipedema diagnosis, they specifically report that they are not doing it for cosmetic reasons. And you may not even have a huge cosmetic result for the liposuction procedures. The primary things they're looking at is just what Siobhan talked about, is pain relief and improved mobility. And along with that, you might also get a better cosmetic look. But it's not, when they put in for getting coverage with an insurance company, that how it is not even part of the equation. And that speaks to that shows that this is medically necessary. So that's very important, that it's something that may be medically necessary. And I would also just put out there too, is that don't just go to one person, talk to several providers, and make sure that, are you a good candidate? What do they say about that, about any other different conditions that you have along with the lipedema? What are the possible side effects that may be not so good? You need to have a really good discussion about that, and hopefully from more than one provider.
Yeah, and not only speaking to providers, but also speaking to people who've had experiences with those providers. So what is the preoperative care that's recommended? Could you get started on some of that now? Right. What's the postoperative care? What's the communication like? How did people enjoy the experience? Did they have good experiences? Were people friendly? Were they well taken care of? Was there good communication? The major thing I've taken from hearing from people who've gone through surgery, sometimes multiple surgeries, is the more questions you ask from the more people, the better.
Yes.
Yeah. Right. And it's a good point when you said multiple surgeries, because majority of the time, this is not a one surgery situation. Doctors can only remove so much of the lipedemic fat at one time. They will only remove it from like one area or two areas at a time, like the backs of your legs or maybe your inner thighs. So several of the people that I talked to, they have had as many as 9 surgeries.
Wow.
So depending on what the surgery is, I mean, if they take care of their whole body, and that each surgery outcome is going to be different. So you may have a really good outcome on your first surgery, and on your second surgery, maybe good, and then the third one you might struggle. So not all surgeries are the same. Kathleen Shimrick here says 9 surgeries. 9 surgeries.
Yeah.
So you have to realize this isn't a one and done thing, and then you have all that care afterward. I'm not trying to steer you away from surgery. I'm trying to say, hey, make you a little aware that this might not be the quick, easy fix that I think often we think of. Oh, surgery will take care of that. Here, Lipedema Simplified, that's one of the reasons we teach about so many of the manual modalities, the things that we take care of in nutrition and those sorts of things. We teach about that so that you can do self-care before and after your surgery or in surgery. And you might not be a candidate for surgery.
Yeah, I love a paper by Dr. Alexander Amato out of Brazil. He's a surgeon who specializes in doing lipedema surgeries. And he published a paper, I think with 2 of his partners, 5 case studies about how lipedema can be treated non-surgically. And so he showed people at different stages of lipedema and what they did for their care. Interestingly, he at a conference, he presented about those 5 case studies, and he said, and here's one that even though she had a wonderful outcome with her non-surgical treatments, she decided to then have surgery at that point. And so now it was less traumatic, less fat that needed to be removed. And she had a very, very nice cosmetic outcome. And I'm thinking probably also improved in other areas as well, as far as pain and mobility and stuff. But she was already had significant impact from her non-surgical stuff. And then she had the surgery. And he commented that this person probably would not have done as well if I had done surgery at the beginning, instead of after she had all of these other non-invasive techniques that just put her in a much better place, that she healed fast and a really good outcome. So, and she's already made now significant lifestyle change that after the surgery, she just keeps doing those things that she's changed in her lifestyle. So
and in that paper, interestingly enough, he specifically says he doesn't think that people should be getting surgery in the inflammatory phase of the disease. So poorly managed, all of that. And if you think about it in terms of surgery is a trauma in itself. I mean, you're removing tissue, you're disrupting tissue. And if your body's already dealing with a whole bunch of other stuff, it may make recovery more difficult. It may make the outcomes less ideal, all of that. So getting your body into a good place, seeing what's left over to deal with, and then doing surgery seems to be his preferred avenue if people are willing to do it. And Kathleen said that she was questioning the 9 surgeries. So it makes sense if you think about someone may have, for one, a lot of volume, and the body can only take so much at once. So one of the surgeons that I talked to out of Berlin said that he doesn't even say, we're going to remove this much during the surgery, we're going to do this many surgeries. He goes in on the first surgery, sees what the response is, and then formulates the plan from there. And so someone could have lipedema from all the way from their hips down to their ankles. They could also have it from their shoulder down to the wrist. They could have it on the buttocks, on the hips, like all over the place. And if there's a lot of volume or a lot of areas, it can expand out into multiple different surgeries, or even just touch-ups afterwards. So you may remove a certain amount, but then you decide, okay, the body's had enough this time, and then you go back again later after the body's recovered. So it can vary a lot.
Yeah. Excellent point.
there's always a certain time between the surgeries for healing.
Mm-hmm.
Sometimes that's delayed depending on how you react and what type of other lifestyle or environmental issues you have. For example, you might end up with COVID in the middle of something,
Yes.
or you have a family situation, and pretty soon those surgeries get pushed out. So there are so many moving factors.
Yeah.
You have to have.
It could be even just an emotional trauma that happens that can interrupt your healing. And these type of things you can't plan for. And so things can get derailed very easily for a variety of different reasons. Doesn't mean that you can't come back from it, but it could definitely prolong the whole process. But definitely, I've talked to women who have gone through these procedures and are very, very, very pleased with the outcome. It's something that takes a lot of work on the patient. The person going through it. It's not that you're just laying there on the table and you're getting this done to you. There's a lot that you have to do to participate in and to promote your own healing.
Mm-hmm.
Right.
So I hope we talked about that a little bit and for you, Marianne, but it's a lot of legwork you're going to have to do. As far as specifically with reimbursement, I did see an announcement a couple months ago from United Healthcare saying that they were going to be paying for liposuction surgeries for lipedema, and I don't think they're the only one. But then you may have United Healthcare insurance, but now you have to have a certain plan under United Healthcare to have that coverage. And then you might still have a huge copay. So it's very individual, very individual. I think there's a couple other things that we wanted to talk about just as in the form of announcements, because there's something that our community has worked very hard on putting together, and that's Emmy's Box of Hope. And Gail, I was wondering if you can talk about that a little bit for people who want to know what that is.
So one of the things that we do with Lipedema Simplified is we reach out to the community, and the community reaches back out to us, and we listen. And one of the things that we have discovered is that the people in the community want to share their information with others. And so during Wisdom Circles, which is a collaborative project, we call it Emergence Strategies. It's been going on for about 1.5 years now. Our community developed something that they called Emmy's Box of Hope. It is a gift to you from the community with Lipedema Simplified. And it is actually a website that you go to for information. I'm going to go ahead and put it in the chat. I'm going to put the link in the chat. We call it Emmy because Emmy is our mascot. She's a cute little flying pig. And she's a flying pig because, pigs don't fly, but she doesn't know that. She doesn't know she doesn't fly because she flies, right? Well, it's impossible. And here at Lipedema Simplified, we say nothing is impossible. Everything's possible with lipedema. You just have to take the next step. So Emmy gives us hope. Her name means Esperanza Milagros, means hope and miracles. And we called it this so that you can find hope within the pages in this website. When you go in, the first thing you're going to see is a tab that says, "Give me my free resources now," or something like that. Oh no, get your free resources here. I think it says. You click on that and you register, and you get a lot of free resources. We have it set up. We have a learn tab in there where you can learn all kinds of things, get free postcards to give to family, friends. We have another type of postcard that you give to physicians. There's joke book in there to help give yourself a little bit of laugh. There's just all kinds of free resources in there, and it's you can go down the rabbit hole quickly in here. So this is a gift to you from the lipedema community that's working with Lipedema Simplified. It's our gift to you. So please click on that and register for it and get your free resources today if you haven't already. And I don't think you'll be disappointed at all.
And can I just point out that Gail is so skilled that she continued to talk as she was grabbing that link and posting it for all of you to get. And she kept talking. There was no break.
Was there no break?
That's a skill.
I think I stutter and stammer. So
I think you did really, really well.
Okay.
And I did check. I opened up that link, and it has the button says "Get your free resources now."
Okay.
So
Give me my resources.
You are right.
I'm like, give me my resources now, right now.
Give them to me now. Yeah. So please check that out. There is one of the things in there is me showing you how to juggle if you would like to learn how to juggle. So, and I would like to just point out, we got a lot of people posting here, and I'm so grateful for you. Of course, Marianne, who had our first question, and Kathleen in Wisconsin, Allie in Sydney, Australia. Thank you for posting, and Marilee with us from Pacific Northwest. I think you're in Chehalis, Washington, aren't you, Marilee? And then Julie, my neighbor in Camarillo, California. It says Tijuana Zerai, I think it is, from upstate New York, is here with us. Gail from Windsor, Ontario, Canada. Andre from Sao Paulo, Brazil, welcome. And of course, you must know Alexander Amado. He's a wonderful practitioner in Brazil. And then Pluto 19 Leo says, has anyone noticed that COVID increases lipedema formation? It seems to have increased, nodules. That is an excellent point. And I've been actually looking at that a little bit myself. And I'm just wondering, Gail and Siobhan, what's your feeling on this topic?
So I don't know about COVID specifically, but getting sick, infection, pretty much anything that puts a lot of pressure on the body, I think, is stuff that I've heard. I know one person commented they had gotten Lyme disease and the texture of their tissue changed, so it started getting that spongy feeling. Yes. So I think it might be one of those things where if you're dealing with lipedema and then you have this other pressure coming in and it is enough pressure that it causes like this overflow of problems where all of a sudden you're struggling, then that might contribute. For me, I've gotten sick a few times since the diagnosis and I've been okay, but that might be just due to where I'm at and my body is able to handle the lipedema plus getting sick and still kind of be able to juggle both of them, if you will.
Yeah. Gail?
Yeah. And in the community, I hear a lot. I hear stories of I'm dealing with long COVID now. You know, they've had issues, and first time they got COVID might not have bothered them, but the next time they got COVID, they're having issues. Now, as far as does it make the lipedema blow up? I'm not sure if anybody has said that the COVID has affected their lipedema. What I usually hear them say is that the lipedema, their state in their body makes it harder to recover from the COVID, is what I usually hear. And now, but it would make sense if you're immunocompromised and now you have something that's attacking you, right? And your immune system has to kick in, that things aren't going to work the way someone who's healthy metabolically and not their fat's healthy, that their body's going to work. It's going to be a little different. So the other thing that we have to remember is this, and it's something that I talk to my women about, Okay, so you had COVID. What else is going on in your life? The stress. We know stress really changes our hormonal balance, right? Did you get COVID as you're entering perimenopause? Right. So what else is going on in your life that the COVID just, what is it? What is that word? Everything just got bigger. It compounded.
Snowballs.
Snowballed on you. So I don't think we have any studies on how COVID has affected lipedema. All we have are anecdotal evidence. So at that point, I
think we need to look at it, as Siobhan said, is that COVID is just one other infection stress, as you were saying. And so it's and how does lipedema respond to all of these different stressors and responses? And so one thing that I've learned from the workshop we took with Dr. Perrin, and now this weekend I'm going to be doing one with Dr. Perry Nicholson, who has something he calls Lymphatic Mojo. And both of these providers talk about the lymphatic system as what's responsible for removing toxins and waste. And anything that contributes to an additional load of toxins and waste, when the lymphatic system is not adequately removing that already, as in lipedema, that the lymphatic system is not taking care of all of the inflammatory particles and stuff like that that's causing the pain and everything in lipedema. So it's already has that load it's dealing with. And now you put something like COVID on top of that, it's contributing to more toxins, more waste that is not being adequately removed. And so I would think that someone who already has a compromised immune system, a lymphatic system, is going to have a worse response to COVID, is going to have a tougher time. Now, you're already doing a lot to manage your lipedema. You've done a lot of lifestyle changes. You've done some nutritional changes. You're getting manual lymph drainage. You're doing these various things. Then you're setting yourself up to probably deal with COVID better because you're helping your lymphatic system with all those interventions. Siobhan.
Yeah, and there are existing studies in people with metabolic syndrome where they do seem to have worse outcomes with COVID. And in terms of obesity and metabolic syndrome, you have a system that's potentially chronically inflamed. You have there's evidence of compromised immunity in them. Just that innate immune response is kind of blunted. And so there's that connection there. They probably have an impaired lymphatic system as well, because it all ties into the same thing. And I don't know if they ever followed up on it, but there was discussion of using ketogenic diets in people in the hospital who had COVID to see if it would help to get their metabolic health back up so that they could deal with it better. So it's an interesting thing where it all ties in back around.
Yeah. And I have to say, not to sound like the dad in My Big Fat Greek Wedding, but it all comes back to lymphatics, okay? It's all about the lymphatics, okay?
I didn't know he said that.
That's a very, very strange movie
Greek lymphatics, right? It's just Greek lymphatics. And I'm looking at Allie says you girls are hilarious. Thank you.
I'm glad somebody thinks so.
No, Anne Marie is from New Jersey, and we have a Facebook user from Michigan, and Carrie is in Lincolnshire in the UK. Welcome. We just had Dr. Perrin here from the UK. So, and let's see, Colleen, new to all this. Welcome, Colleen. I hope you're getting some helpful information as we sit here and chat. And Pluto 19 Leia also says, I notice it's sponginess in the thighs. That's a weird feeling. Is that from the lymphedema? Actually, you say lymphedema, but I think that sponginess is probably from the lipedema. Is that, Gail and Siobhan, is that how you would characterize when you feel that fat? Would you say it feels like sponginess? Yes.
Pick me.
Yes.
Me too. You first, Gail.
Okay,
Go ahead, Gail.
Me first or you first? Anyway, so I don't have all the words, right? I have very few words. No, I don't. I have a lot of them, but they don't make much sense. So I had my physical therapist give me I said, tell me what I feel like, right? I wanted to have a description of what I feel like. Yeah. So as she's going through my body, she has her eyes closed and she's palpating and squeezing, and she was saying words and writing them down and everything. And all of a sudden the word boggy came up.
Interesting.
And I'm like, I don't know what boggy is, right? And then she said, and people have said, maybe it was Siobhan, I don't know, probably was Siobhan. You know, when you step on overwatered grass, how it goes, it feels boggy. Oh, that's sponginess, isn't it? Yeah. And and as she was comparing one arm to the next and one leg to the other, every now and then she'd use the term boggy, like spongy, and it feels full of fluid and full of like it shouldn't be there. And so when I think about sponginess, that makes me think of boggy.
Yeah, like a waterlogged sponge, or like a peat bog, a bunch of moss and a bunch of peat that's been so waterlogged it goes like you said. And so when I've spoken to my lymphatic therapist about that, because we often do texture check-ins just to see how everything is feeling and if anything is changing, the bound fluid, she said, is what might be causing that. So not the free fluid like you would have with lymphedema where you press into it and it just goes in and sticks. It's that it has that rebound to it, but it's still waterlogged. And she said that she associates it more with the bound fluid, which we see in lipedema. And I've had that pretty much everywhere where I have lipedema. I've seen it pop up before. And another interesting thing is that when I'm experimenting with different stuff, I've also seen it reduce. So I don't think it's necessarily there forever. I think it can change. It's one of those things where it's like, what causes that? Where is that coming from? Why is that happening? I don't know. I don't fully understand yet, but it does seem like it can change, and it does seem like it's lipedema related. It's related to that fluid that's in the tissue and getting bound up in there. And
So like Kathleen said, her legs used to be hard, and now it's more spongy. And I have found the same thing with the work I've been doing. Now my legs don't feel so hard. Sometimes they feel jiggly and spongy and gushy, which is a totally different feeling. I mean, I don't mind it. It's right. It's a lot of fun to jiggle and wiggle, but it's just a totally different feeling than full and hard and rigid. It makes I can bend my legs better because of it. But so anyway, Susan wants to know how you reduce it.
And Susan says, how do you reduce it? So, and that's a lot of things that we talk about as part of Lipedema Simplified, a lot of different interventions that you can do with typically it's a certified lymphedema therapist. Right now, we don't have what you might call a certified lipedema therapist, but hopefully you can find a certified lymphedema therapist that has expertise and experience in lipedema, and they can try different modalities. Might be just with their hands, might be with some devices. They might use something like cupping or instrument assisted to reduce the fibrosis. They might use a deep oscillation with like a Hyvamat or a Lymphatouch. They might use infrared. They might use, there's all kinds of different interventions that could be done. your friend is going to be your lymphedema therapist, and explore those with your therapist. You may not be appropriate for all of them. You may not like all of them, but it takes a little gentle experimentation to see what might be good for you. And definitely people have noticed these texture changes just with diet. Just by cutting the carbohydrates out of the diet, we've noticed a change just with that. Siobhan?
Yeah, and I would say for me, it's been both. So what works for me isn't going to be the same as what's appropriate for everybody. In some cases, you have to look at, I mean, in all cases, you have to look at the whole person and kind of evaluate what are they dealing with, what should be addressed first. Do we want to put this other stuff on pause while we work on this stuff? So it's not like I can say, just do this and the sponginess will disappear, because even for me, that hasn't been true.
A recipe and that this is going to work for each person.
Yeah, it's very much
experimentation.
A lot of experimentation. And for me, it's both been working with a lymphatic therapist and specifically experimenting, because some stuff we try and it's like, nah, that doesn't seem to be making much of a difference. We put that aside. Some stuff we try, it does seem to help, and often it takes a while. So it's a long process, not like go in for one session for a couple months and it's all good. It's an ongoing thing. The other thing that seems to have helped for me is fasting. So alternate day fasting for me seems to help reduce it. And it's interesting in that it hasn't been reducing it and then I take a break from fasting and it comes back. I'll do the alternate day fasting and I'll get improvements and then they'll stick around. So it's another thing where it's like, I don't know why it does that, but for me, it seems to be helpful. For somebody else, maybe totally inappropriate and it doesn't make them feel well and it's not a good fit. So there's not anything where we can say, do this and you'll get this. Depends on your body.
We want to give you ideas of things to try. I do want to, before we end today, I think it's pretty important that we answer Whitney Napier's question, because she's asking about lumps in the breast. And, you know, that could be a sign of breast cancer. So I do want to talk about this. I have this fat in my breasts and makes it hard for me to know if it is a lump that's concerning or not. I'm 35. Should I go have an early mammogram? I would rather you get it checked and it's nothing than not do anything and have it be something. And so I'm always on the conservative side on that. There's a lot of different opinions on what's the appropriate way to screen. Is it a mammogram? Is it a thermogram? You know, is something else? I can think the key thing is that if you've been doing regular breast self-exams and this is a new appearance of a lump, then that's pretty concerning. But if maybe you hadn't been doing them and you're kind of just lumpy everywhere, and then you notice that, gosh, it seems like now I also have lumps in my breast, do a baseline. Go to your, I'd start with your GP or your gynecologist, have them check, and then they can guide you on whether or not maybe you should have an early mammogram, or if it's, I mean, some women just have lumpy breasts. So I don't want to alarm you that, oh my gosh, this is breast cancer. I don't know, but it's anytime there's a lump that we haven't seen before, it's concerning.
Yeah, and I had a breast exam recently, and basically what she said is just do your own manual exams as often as you can, in the shower, in bed at night, whatever it is. Get familiar with how it feels, so then if anything changes, you are aware as soon as possible.
Yes.
And then there are also alternatives if you're concerned about mammograms or whatever. There's ultrasound, there's thermography, like you mentioned. Even the manual exams through a skilled practitioner can be helpful. So there are different options. So if you're concerned about it, you can just talk to your doctor, say, hey, I have this condition. It may contribute to this. Can we discuss what kind of options are going to be good for me? And then go from there. And just keep an eye on it. Like, that's one of the things everybody can do is just, I'm aware this may interfere with this. It may cause weird stuff. Maybe you have fibrous breast tissue. And just try and keep an eye on it since you already have that in mind.
Gail?
No, it's really important. I used to get really concerned when I was younger about why my breasts feel like they do, right? I'd read about what a lump felt like, and of course in my brain I'm like, well, that's what it feels like. That must be then. And so no, really. I'm like, oh, that is what I'm feeling. So I went to a doctor and he gave me a breast exam and he says, he goes, you have granular breasts. And I'm like, oh, so it feels like there's teeny, teeny, tiny little BBs in there, right? I have granular breast tissue. And every time I had a manual exam during my annuals, they would say, oh, you've got granular breasts. My mammograms were always clear. Now, is 35 too young to get a mammogram? I don't think so. If you need a breast exam. However, go to your GP or gynecologist. They'll order one. They'll send you to an imaging center, and if your GP orders one, then it's usually it's covered in your insurance, even though you're only 35. But it's really important to be body aware. Do a self check, right? Okay. My toes look like this. My ankles look like this. Oh, that part of me looks like this. This part of me looks like that. Feels like this. And just keep aware when you notice a change.
Yeah. Yeah. And if you're someone who has Durkheim's or lipedema, and we tend to get these fat nodules associated with those conditions, it can make it very confusing. But I would definitely at least have that consult with your healthcare provider and get their advice on if you should proceed further than that. So I wanted to make sure that we address that one. Sure.
And let me just add in a suggestion for any teen magazines, if they still exist, like 17 magazine or whatever it is. When you have those articles about this is what breast tissue feels like, please add in a mention. And by the way, you can also have granular or fibrotic breast tissue. Here's what it feels like. If you feel this, just check in with your doctor and confirm that's what it is. Because I had the same experience it was 17 magazine specifically. They had this article and it's like, and here's what like a lump feels like and when you should be concerned. And it's like a bowl of oatmeal and some grapes. And it's like, but what if it's all grapes? Then what? And they didn't even mention it. But there are some things that can be normal, but they're worth noting that that's what it actually is. So please, if teen magazines still exist, please mention the alternate to normal that people should be aware of so they don't get freaked out.
And then as soon as you have your baseline and you and your healthcare provider know what your baseline normal is, normal for you, then you're able to detect anything that is different from your normal. So and we've gone way over our time, but for those of you that have stuck it out with us, we sure appreciate you being here. And for those of you watching the replay, thank you for being with us. We love to hang out with you guys on Fridays, and we're here every Friday at 4:30 Eastern time. And we would love to get together again with you next week. So until then, bye everybody.
Bye-bye.